Well, thank you so much, and thank you for the folks who are joining in now. My name is Manny Yakutiel, and we are, this is Manny's Super Civic Cyber Conversations. We had a physical space. Unfortunately, we had to shut down, but just because the space is closed does not mean the work is over. And so we decided to bring our civic programming to the public through these online conversations. And two housekeeping notes. One, you can tag us at Welcome to Manny's at any time. And two, if you have a question for Council Member Ritchie Torres at any time, you can type it into the Q&A box and we will ask, and I will ask those questions of Ritchie. This conversation will take between 20 and 30 minutes, and then you can be along your way. I want to be extra tight on time because it is 10 o'clock Eastern time. So Council Member Torres is up late for us. And so I want to be very conscious of his time, and also just very thankful to you, Ritchie, for taking time on a weekday evening this late to speak to the Manny's community. So thank you.
Of course.
So I want to talk about a couple things. I want to talk about the fact that you have had the coronavirus, and then I want to talk about what's going on in your district, okay? Because you represent the Bronx, and the Bronx is one of the hardest hit parts of New York right now. So let's start with you personally. How are you physically feeling, and can you explain what your experience was like coming down with the coronavirus?
So I feel as healthy as I've ever been. You know, I after 3 weeks of quarantine, I no longer have symptoms. I'm presumptively immune. I'm going to remain at home for just about a week more, so that I'm assured that I have no infection.
Yeah.
Because I have, my mother's 60 years old. She has pre-existing conditions, and I'm a little apprehensive about seeing her just now. I had a mild experience. The experience of the coronavirus varies widely from person to person. Mm-hmm. I had a fever, cough, chills, but I only had symptoms for a week, and I was able to manage them without even seeing a doctor or going to the hospital. For the first time in a long time, I actually got 8 hours of sleep consistently. So in some sense, it was a blessing in disguise. But I had none of the worst respiratory symptoms that we've come to associate with COVID-19. As a child, I actually had severe struggles with asthma. I was repeatedly hospitalized because of asthma attacks. And I noticed that when I moved out of public housing in my early 20s, because public housing is known to have mold and vermin, all of which are known triggers for asthma. When I moved out of public housing, my asthma subsided over time. And so I wondered to myself, if I had continued living in public housing, if my asthma had persisted and I contracted the coronavirus, the outcome could have been different. So I consider myself lucky.
How did you know you had coronavirus?
So,
is there a moment where you're like, it's not like a normal flu?
No. So my chief of staff had all the symptoms, and his doctor arranged for him to undergo testing. And he found out that he had the coronavirus. And so since I have a history of asthma, and since I had contact with a confirmed case, I underwent testing. I tested positive, and I had to direct both my campaign staff and my government staff to all quarantine themselves. And then I had to isolate myself for at least 2 weeks.
Did that affect your campaign in a drastic way?
I mean, everything has been brought to a grinding halt.
Yeah.
The campaign has taken a backseat, and I've been focusing like a laser on ensuring that the hospitals in my district have enough personal protective equipment, and that my constituents have access to enough food.
One more, just before we move on from your experience with the coronavirus, what was the quarantine like? I mean, I've known you now for a couple of years, and I know you as a major doer, but I also know you as someone that appreciates, your private time. So were you, was it like, were you just so tired of, were you in your apartment? What did you do all day? What was the experience like of being quarantined for so long? Were you allowed to go outside? Did you go outside?
Yeah. So no, I had a pretty draconian self-quarantine. I could not even go outside for exercise because I was a confirmed case. And there were moments when it took a toll. There were moments when I was struggling with depression because I'm accustomed, to being an elected official who can go out in the field and interact with people and productive and busy at every minute. And I have a staff at my disposal. And now I could not even go across the street to get a bottle of Tylenol. Like I was a prisoner in my own home, and it was demoralizing at first.
And also, I can imagine just did you have to be so public too? I mean, when you confirmed positive, there were news stories all over the country about an elected official in New York coming down with it. Did you get, what was that like, all the attention, the media attention for having a disease? Did it trigger you somehow? I know that like some folks are feeling like, there's some.
So I look, my natural instinct is to keep private matters private. Right. And I consider my health private. But since I was a public official, I felt I had an obligation to disclose that I had the coronavirus. Because if I had not disclosed it, then someone would have accused me of hiding. It could have become a scandal. So I said, it's better to err on the side of transparency, let the public know that I have the coronavirus. And I thought it was important because, since I'm the youngest member of the city council, right, at age 32, I'm a millennial. Right. It's particularly noteworthy that I have the coronavirus because there is a misperception that the coronavirus only affects older people or those with pre-existing conditions. Right. I stand as living proof that millennials can both contract and spread the coronavirus. Right. And that we have an obligation to practice social distancing.
I just have one more question about your experience with the coronavirus. What was it? It was about, now that it's over, now that it's done, do you feel, I guess you're still in quarantine, but so I guess this question's a bit moot. What I was going to ask is like, are you worried about the way people act around you, come near you? There are some reports in the New York Times of folks, ending quarantine and like not wanting to hug their kids and not just for fear of infecting someone, just like it really demonstrably changing the way they move around the world. Is that something you're worried about or you're feeling now?
Look, here's what I would say. I would say, regardless of whether you've tested positive, all of us should be acting as if we have tested positive. All of us should be acting as if we are carrying the virus and then adjust our behavior accordingly. So I tell people, if you're old, stay at home. If you're sick, stay at home. If you're immunocompromised, stay at home. And if you're none of the above, you should still stay at home. Right? As long as the outbreak remains a fact of life, the most responsible thing to do is to practice social distancing, which means avoid shaking people's hands, avoid hugging, maintain a distance of 6 feet, wash your hands thoroughly and consistently, right? Disinfect surfaces, avoid touching your face, wearing a mask. Like those are practices that each of us are going to have to adopt as long as the coronavirus remains a threat to public health.
So let's talk about your district in the Bronx. And first of all, I just want to say, thank God, I'm glad you're feeling okay and that you're doing all right. The second I heard about it, I reached out to you, and I was glad to hear that you're okay now. Yeah. So you represent,
and you can break the bad news to all my political enemies. Then I'm alive and well. No,
okay, I will. But is this the first interview you've done?
No, I've done a few interviews.
Okay. So you represent a big part of the Bronx. The Bronx, of course, has been very hard hit by this virus. Can you tell me what you're hearing from your constituents, what's going on in your district? And then also I wanted to give you an opportunity to talk about how this virus is twice as deadly for Black and Latino people in New York City than for white people, and why you think that is.
So, New York City has become the epicenter of the coronavirus outbreak, not only in the United States, but in the world. So New York City is the epicenter of the epicenter, and the Bronx is the epicenter of the epicenter of the epicenter. So, obviously New York City is naturally vulnerable to an infectious disease, right? The coronavirus spreads primarily through person-to-person contact. It thrives on density, and New York City is a densely populated hub for international travel and tourism and commerce. We have millions of people who live in crowded apartment buildings, who ride crowded subways. And so, wherever you have density and proximity, you're going to have a higher risk of infection.
Right.
It's become clear that even though the coronavirus affects all of us, it affects us unevenly. Right? Communities of color are the hardest hit. Places like the Bronx are the hardest hit. The lowest income communities are the hardest hit. We often speak of flattening the curve, but the truth is, in the United States, there is no single curve to flatten. There are multiple curves, and communities of color are on the deadliest curve. And the data we have in New York State indicates that African Americans and Latinos have twice the likelihood of dying from COVID-19. And that statistic factors in age. So apart from age, the single greatest risk factor for COVID-19 morbidity and mortality is racially concentrated poverty.
Why?
For a few reasons. I mean, take the Bronx. Why is the Bronx hardest hit? One is it has the highest rate of poverty. Two, it has a greater prevalence of pre-existing conditions. So 86% of the fatalities, COVID-19 fatalities, have at least one comorbidity. And the most common comorbidities are hypertension and diabetes. The rates of higher tension are more than 3 times higher in the South Bronx than in the financial district in Manhattan. Right? Diabetes is more than 5 times more prevalent in the South Bronx than in the financial district in Manhattan. So since the Bronx has a higher prevalence of pre-existing conditions, it's naturally going to have a disproportionate death toll. And then part of it is occupational hazards. So COVID-19 has split the workforce into two. There's the professional class, which is largely working from home.
Right.
And then you have the service class that has to continue working. So you have the Bronx is heavily represented
because of essential businesses.
Because these are essential workers. Right. So the Bronx is heavily represented among essential workers. And so you have public employees, service employees, healthcare workers who are risking their lives on the front line so that the rest of us can have the luxury of working from home. And so people should never forget that social distancing, however inconvenient, is a privilege of the professional class because there are low-income people who are risking their lives every day on the front lines so that the rest of us can stay at home.
Tell me,
and then there's one more factor. There was a study by the T.H. Chan School of Public Health at Harvard revealing a close correlation between poverty and pollution. Between COVID-19 mortality and pollution. And pollution is heavily concentrated in communities of color. And so if you're living in a low-income community of high pollution, then you're breathing in, through no fault of your own, environmental toxins that predispose you to the worst of COVID-19 and its comorbidities.
In an ideal world, which is not the world we live in, as you well know, an area like the area that you represent, given all of those factors, should have the best health care because there's the greatest chance of the people in that community having this virus. But I would guess that the hospitals in your district are not the best hospitals in New York City, or maybe they are, maybe they're not. But can you tell me about the kind of health care that your constituents are getting? Are they getting the same amount of care with the same quality as all the other places in New York City?
Look, the hospitals in the Bronx do the best they can with the resources they have. But the fact is, hospitals in the Bronx have far less staff, far fewer resources, far less wealth than hospitals in Manhattan. So there's an inverse relationship between need and resources.
Right.
The communities that have the highest need tend to have the fewest resources, and the communities that have the fewest needs tend to have the most resources. And the disparities in the death toll tell a sobering story about American society itself. You know, I've said before, we often speak about the immune system of individuals, but what about the immune system of American society? Right? American society has a compromised immune system that has left communities of color especially vulnerable to COVID-19 mortality. Right? The fact that we do not have a comprehensive social safety net like universal health care has made communities of color more vulnerable than ever.
Do you feel like the governor and the mayor are marshaling the resources necessary to try to close that gap in your community? Obviously, this is known. He talked about the disparity amongst Black and brown people in his press conference this morning. He understands it, but he also has the ability, both of those men, probably to make sure that resources are being allocated appropriately to affect that. Is that happening on the ground?
It's unclear. So we have data on the need, where the need is, but there's no data on where the resources are. Like there's no one be outside the mayor's office or the governor's office knows, you know, whether the hospitals in the Bronx are receiving their fair share of ventilators or respirators or staff. Only the executive has that information. The rest of us are largely in the dark. And I have to be honest with you, I'm skeptical that we have our fair share. You know, the Bronx historically has been underserved. And so I worry that we have far fewer resources than much wealthier counties.
I know you've been quarantined, but tell me from what your staff is telling you, or what you're seeing from your window, or you know, what you're hearing on the ground. What does it feel like to be in your district and to be in the Bronx right now? You know, San Francisco, we've been in our apartments for, you know, almost a month now, and it's a ghost town for the most part, other than the parks where people are running. What does it feel like in your district in the Bronx right now?
It has the feel of a ghost town. You know, most people are complying with social distancing. You might find a few anecdotal examples of young people rebelling, but for the most part, people seem to be aware of the seriousness of the public health outbreak and are largely remaining home. You know, the people who are outside are those frontline workers who have no choice but to put themselves at risk. And it's, you know, it's worth, the densest city in the country is New York City.
Yeah.
And the second densest is San Francisco.
Are we the second densest?
I believe so. And
Okay.
San Francisco, but even when you factor in density, San Francisco has disproportionately a much lower fatality rate. I think San Francisco has had 10 fatalities, somewhere in the range of 10. New York City has had somewhere in the range of 5,000. And so the question is, why do we have 500 times more fatalities in New York City compared to San Francisco?
Do you believe it's because we sheltered in place a week before you guys did?
Exactly right. I think San Francisco took action earlier and more effectively. And when you're confronting the spread of an infectious disease, time is of the essence. Every hour, every day matters.
I remember getting the notice from the mayor that gatherings of more than 50 were going to stop when we had like 6 cases. You know, there weren't even cases yet, and she, you know, basically said that my business couldn't run anymore. And then I think we had 60 cases when the whole city was shut down. I mean, complete shutdown. So. Yeah. He did take, and no one complained about it. Everyone was like, okay, you know, we're gonna do this. We're gonna trust it. And you know, it does look like that decision probably saved a lot of lives. And so we're thankful for our mayor for doing that.
Yeah. Whereas we had our first case on March 1st, and New York State and New York City did not implement a shelter-in-place order until March 22nd.
Yeah.
So we went 3 weeks without shutting down the city. And, you know, according to the former city health commissioner, you know, if we had taken action a week or two earlier, we might have reduced the death toll somewhere between 50 to 80%.
So the decision to reopen New York City, you're a member of the city council. Is that a decision that you can weigh in on, or is it an executive decision purely?
It's ultimately an executive decision. It's the governor's decision. It's the mayor's decision. In moments of crisis, the power dynamics shift decisively in the direction of the executive.
So what is the City Council of New York working on right now?
I think the city council is mostly checking in with hospitals to ensure that our frontline healthcare workers have enough personal protective equipment, to ensure that our constituents have access to food. The city council, in partnership with the mayor's office, has established 400 meal hubs throughout New York City. Great. That offer 3 meals a day to any person, any family.
Great.
And you can pick it up from 7:30 a.m. to 1:30 p.m. Monday to Friday. So I think we've made real progress toward ensuring access to food at a time when people have lost their jobs and their income.
Mm-hmm. To the folks who've tuned in, if you have questions for Councilmember Ritchie Torres, you can go ahead and type it into the Q&A box at any time. We'll be ending this in about 5-10 minutes, but if you have questions for Ritchie, you can type them in now and I will ask them.
Yeah.
So one of the things we've talked a lot about out here, Ritchie, is Rahm Emanuel's quote of with every crisis comes an opportunity, and maybe ways in which San Francisco is working really quickly now in ways that we've always wanted but we haven't seen. Do you feel like there are ways in which New York City can utilize this crisis as an opportunity in some respects to, like you said, you're feeding everyone who needs it 3 meals a day? I mean, that's a big thing to do. So are there ways that you're seeing this be able to are there opportunities that are being presented?
No, I'm familiar with the quote. I think Rahm Emanuel famously said a crisis is a terrible thing to waste.
That's what it was.
I think life as we know it is destined to be radically reshaped. It has been radically reshaped. We often speak of a post 9/11 world. There's going to be a post COVID-19 world, and we have the power to shape what that world looks like. And I hope that it will move the country in a more progressive direction. Yeah. That a post COVID-19 world will see the wisdom of adopting the kind of comprehensive social safety net that is the norm in the rest of the industrialized world. Right? That this is why we need universal health care. This is why we need access to fresh food. Because without that safety net, you're putting communities of color at greater risk of morbidity and mortality. Like the inequalities have been brought painfully to light, and those inequalities are too glaring to ignore.
I want to ask this, Ritchie, because obviously I care about it, but also it's a question that's important to ask in general. You're in the middle of a political campaign. You're running for Congress, and we're also in the middle of a presidential campaign. How are people going to run for office? Obviously, now is not the time to run for office, right? Because people are dying, literally dying. But right. in your election is in November?
No, it's in June.
In June. Holy moly.
Well, the primary's in June.
Right.
The general election is in November. But the Bronx is the most Democratic district in America, so whoever wins the primary is destined to win the general election.
The end of June or the beginning of June or mid?
The end of June, June 23rd.
So it is possible that New York will be allowing people to go door to door by the time, maybe it'll be right before the election. But how do you run for office?
I have to be honest with you. So we were planning to invest about $500,000 in a field operation.
Yes, I remember.
Massive door-to-door GOTV operation. So that has been discarded. I have trouble imagining knocking on doors and dispatching canvassers to knock on doors in the midst of a public health outbreak. So I think campaigning is largely going to be centered around traditional mail, digital advertisement, digital campaigning, and television. I mean, field has largely been taken off the table, given the risk of, because even if we manage to flatten the curve at a level that the healthcare system can manage, And even if we relax social distancing guidelines, we're at risk of a resurgence.
Mm-hmm.
We cannot return to business as usual for COVID-19, right? There's going to be some measure of social distancing, some measure of restriction, and it's going to hamstring our ability to run a traditional campaign. So we have to, radically reimagine, how do you run a campaign in the midst of mass quarantine? And much of it is done digitally.
I want to just give you the final word here. Actually, before I do that, are you scared? Are you afraid for your constituents? Are you afraid for yourself? Are you scared about the future?
I am, because the Bronx was struggling even before COVID-19. And so even though the crisis is catastrophic for the United States as a whole, it's going to be even more catastrophic for places like the Bronx. For me, there's no greater scourge than long-term unemployment. When you've been unemployed for a long period of time, you become unemployable, and there's a whole host of problems that result from unemployment, from alcoholism to opioid abuse to suicidal ideation, depths of despair. I worry that long-term unemployment is going to be corrosive, not only to our economy, but to the social fabric.
I want to honor a question that's being asked from the audience, but I also just want to thank you for that very eloquent answer. You always continue to inspire me. Mark, you brought up the disparities of specifically the Black community in COVID-19, and Mark is asking whether or not you think that one solution would be to push Congress to approve reparation package to close the racial wealth gap.
Yes, we need greater investments in communities of color. I mean, wherever you have racially concentrated poverty, you're going to have far worse outcomes in every arena of life, whether it's housing maintenance, public health, access to education, access to fresh food. So if we are able to drive down rates of poverty with investments in communities of color, that's going to strengthen the social immune system of Latino and African American low-income communities.
Okay, I just wanted to honor that question. Ritchie, do you have any final word, anything else you want to say? Anything that you want to speak to as we close this program, as you, I hope, go to bed after this? Anything you want to say to me as a friend? I miss you.
I miss you too. I'm fortunate to have you as a friend. And only for you would I do an interview at 10 p.m. Eastern time.
Sorry.
But I have hope. I'm hopeful that we're going to emerge from the crisis stronger than ever. And, those of us who hold deeply progressive values, we have a historic opportunity, to reshape the United States in the image of our highest ideals and aspirations, and lift the most vulnerable out of poverty and give them a fighting chance at a decent life. So I think that is our mission going forward, and I'm excited about pursuing it.
Thank you, Ritchie. In place of asking people to become sponsors of Manny's, instead of that, is there a place, if someone wanted to help, with the issues going on in your district or the hospitals in your district, is there a website or a fund of some kind where people can donate or go to?
Yes. I mean, I think there are two areas. One is food. There are organizations like the Food Bank of New York City, Met Council, City Harvest that desperately need donations to sustain food pantries. More than a third of the food pantries in New York City have collapsed. Mm-hmm. And so there's a desperate need for an infusion of private donations. Mm-hmm. And then support for our healthcare workforce. So Health and Hospitals, New York City Health and Hospitals has a fund on its website. It's receiving private donations. Right. So whether it's food or healthcare, we desperately need public support.
Okay. Councilmember Ritchie Torres, my inspiration, my hope.
Thank you.
Thank you so much for the time, and sleep well.
It's always a pleasure.
Good night, everyone. Thank you for tuning in. Bye, Ritchie.